Today, welcome everyone to the Guam Congress Building. The Committee on Health, Land, Justice, and Culture is now called to order. Today's Thursday, October 19, 2023, and the time is 2:20 p.m. Thank you for your patience as we started. We had to get a PowerPoint up as well as we're Zooming somebody in by audio. Thank you. In compliance with the open government law, notices for this public hearing was published in the Guam Daily Post and posted on the Government of Guam Notice portal on Thursday, October 12, 2023, and October 17, 2023, Tuesday. Notices were also sent by email to all senators and all main media broadcasting outlets, and this hearing is being live streamed on the Guam Legislature's YouTube channel. Individuals testifying shall first be recognized by the chair before speaking and begin by stating their name for record-keeping purposes. This is an oversight hearing on the new Department of Public Health and Social Services CDC Lab, and I'd like to acknowledge the presence of my colleagues, beginning with Senator Chris Barnett, Senator Jesse Lujan, Senator Tom Fisher, Senator Chris Duenas, and Senator Roy Kanata. Sidus Masi colleagues for being here today. All right, just for clarification, I did send some letters to Department of Public Health between the time that the notice was published and this hearing to clarify. One of them said, in anticipation of the oversight hearing on the DPHSS CDC Lab scheduled, I request the following information relative to the grant received, specifically any mention in application or award of potential location of lab, the size of the lab or acreage requirements, and status of the construction of the CDC Lab. I also sent out, looks like 10 questions, which Public Health also answered, and all of this is in the senator's packet, but for those listening, the questions were, was there any mention in application or award of potential location of lab? The answer was no. Was the size of the lab or acreage requirements? The answer was 5 acres for Guam Public Health, BSL L3 building, and building support. The status of the construction of the CDC Lab, it says we are currently in the design development phase. When does the DPHSS CDC Lab grant expire? It says August 2026. According to your grant application or award, what other sites were considered for placement of the lab? It says the guidance was limited to parcel/property size. Question number 6, according to your grant application or award, what role will the lab serve in GMH acute care? The answer is, as part of the community, the new lab will continue to provide analytic services to medical providers in the community and regionally as well. GPHL with maintained CLIA compliance, trained and competent testing personnel, serves primarily as the reference lab to perform confirmatory testing within 24 hours turnaround time, TAT, for infectious communicable diseases, biosafety level 2 and 3 pathogens, and to provide training for point-of-care testing and test kits as needed. GPHL will build in-house capacity and capabilities for next-generation genetic sequencing, pathogen sequencing for routine surveillance, outbreak detection, and public health preparedness for emerging infectious diseases, to integrate genomic data with epidemiological information that will aid in disease control efforts and outbreak investigations. GPHL will conduct in-house confirmatory testing for antimicrobial resistance and outbreaks using sequencing, bacterial culture systems, VTEC2 MALDI biotyper for foodborne disease testing, and molecular assays. Client/maternal child health, women, infant, and child, WIC, tuberculosis, leprosy, STD, HIV, vaccine preventable, epidemiology, surveillance of outbreak-prone diseases for GMH, DOC, USAPI, that's U.S. affiliated Pacific Islands, 2017 GCC phlebotomy technician summer training project. Question number 7, what role will the lab serve in Guam Behavioral Health and Wellness Acute Care? The answer is GPHL, with maintained CLIA compliance, trained and competent testing personnel, serves primarily as the reference laboratory to perform confirmatory testing within 24 hours turnaround time TAT for infectious communicable diseases, biosafety level 2 and 3 pathogens, and to provide training for point-of-care testing and test kits as needed. Question 8, in other jurisdictions, is the lab attached to a hospital? Answer, DPHSS is not aware of what other jurisdictions do. Question 9, what is the status of the current public health lab in Manilao? Answer, since the decision to move out of the central facility in the building, requests made to have the building assessed for safety aspects and possible renovation to have program services available similar to a one-stop center. Question 10, can this lab be placed adjacent to the mosquito lab in Dedido? Answer, it is unknown if that area will meet the requirements of the grant. And this is from the director, Arthur U. San Augustine, but it looks like it was signed by someone else. Is that the acting director? All right, acting director. And we're going to have them introduce themselves now. They also do have a presentation for us. So, acting director, please introduce yourself and the team.
Thank you, Madam Speaker. My name is Peter John Camacho. I'm the Deputy Director for the Department of Public Health and Social Services. But for today, I'm Acting Director. I'd like to introduce the team. To my far right is Ms. Anne Marie Santos. She's our lab director. We have Ms. Annette Uggan, who is the administrator for the Bureau of Communicable Disease Control, but also now the acting chief public health officer. To my left is Mr. Sabino Flores from the Community Defense Liaison Office. I have Ms. Estelle Ada, who is with the epidemiologic, please, sorry.
Program Manager for the Epidemiology and Laboratory Capacity Program at Public Health.
Okay.
Could you repeat the name again?
Sorry, Epidemiology.
The name, your name.
Oh, I'm sorry, Estelle Ada.
Okay.
Thank you.
And at the far left is Mr. Alan Malari. He's our supervisor in the Guam Public Health Lab.
Okay, great. Welcome to all of you, and thank you for being here.
Oh, I'm sorry, ma'am. And via Zoom, we have Dr. Magda Vasareddy. So she's here, joining us by Zoom.
What is her position?
She's the medical director for the lab.
For the lab. Okay,
Yes.
thank you. Again, welcome. This oversight was called to gain information on this lab. As you know, the medical complex plans include construction of a CDC lab, and we have heard from the governor that the grant is expiring soon, so we hope to explore the requirements of this lab pursuant to the grant. All right, and so we will have public health, you may begin your testimony, and I want to acknowledge that there is a PowerPoint, and so the senators have been given a copy, and I know that the PowerPoint outlines a lot of your success, but I've asked you to shortcut to the points regarding the future plans, but you may proceed.
Okay. Thank you, Madam Speaker, and I'd like to turn it over to Ms. Anne Marie for the actual presentation of the slides.
Good afternoon, Madam Speaker and everyone, senators. Basically, GPHL, which is the acronym for Guam Public Health Laboratory, our future plans, it just lists here on the slide that we will start with is our action and our sustainability plan. So the action locally would to be prepared and to have available resources readily available for the people of Guam so that we can detect emerging and re-emerging communicable infectious disease that require the biosafety level 3 pathogen or biosafety level 3 containment for these risk group number 3 pathogens. And some of them are anthrax, encephalitis virus, hantavirus, the HIV, malaria, Q fever, and tuberculosis. Currently, we are performing tuberculosis but only the smear. And we're practicing the best practices for BSL-3 containment. But our laboratory staff is following requirements. We are CLIA compliant and BioSafe compliant throughout our inspections every other year. We successfully passed the past inspections, including COVID time, without any deficiencies. And so we are currently doing tuberculosis, which is a BSL-3 pathogen. West Nile virus and yellow fever, we don't know when that time will come, that this emerges or reemerges in the Pacific region. We are actively recruiting and hiring technicians and microbiologists. We are engaged with the University of Guam and Guam Community College. That's why it was stated there in the client that we had a project in the past and we maintained that project, and we will reestablish, update, and modify all the MOUs that we have existing. And we do have everything existing with all our partnerships, which I have listed in the next few slides. And I think it's very important for partnership and collaboration, because we have to do it together, especially with the sustainability. We need support, not only financially, but for education and reinforcement of the future workforce for the future pandemic. And it's not only for us here today, it's for our future. So we would like to set up foodborne testing, which we haven't done for over 10 years. We want to revalidate that for Salmonella, Shigella, Vibrio culture. During the FESPAC of 2016, we had to send it to reference laboratory and DLS. So in the front slides, there are disadvantages, of course, for sending it out to reference lab. Turnaround time will take 2 to 4 months. So to highlight some of the sustainability, we propose supply compensation may be less than or equal to 50% of the test costs. In my previous slide, there are test costs already proposed for each of the tests that we do. They are very expensive, but it's because we have that the cost outweighs the saving of the life, because we can detect it within 24 hours. GMH has been our consistent client, the Guam Memorial Hospital and the Seventh-day Adventist. Every day we still continue to receive, and we're monitoring now influenza A, influenza B, respiratory syncytial virus, and SARS-CoV in addition. So they're all respiratory. So the BSL-3 pathogens are inhalant. They're respiratory viruses that can affect the whole population in a split second. So our BSL-3 containment is very important. But to propose a sustainability action, we want the capability to bill for services, and we have this test cost, and we can just have supply compensation to equal 50% of that test cost until the capability to bill for services are operationalized. So the next slide shows the floor plan, which
All right, sorry, we're going to take a, just pause right here until we get the slides up. All right, we'll wait for audio. Can you just clarify while we're waiting for the slides? I know, so Guam Public Health is running a lab right now. They ran it for us through COVID. Thank you for all your work. But what is the difference between that and the CDC lab that they want to build at the new hospital site?
Right. Currently, we are renting due to the evacuation of 2019 for the electrical smoke. Currently, we do perform with best practices for a BSL-3, but even the biosafety, the BMBL, CDC requires a BSL-3 facility for us containing these pathogens that I just mentioned, which is anthrax. So we're not able to handle anthrax. If there is a possibility, we would just practice the best process and procedure guidelines from CDC in order to tackle this pathogen. So a BSL-3, so the new facility for the future is not only a containment for these risk-3 pathogens, but also for unknowns and also for training. We have a training room that will be part of this building. So we're hoping that the building will support everyone and anyone in the Pacific region and also nationally. We are part of the Association of Public Health Labs. It's called APHL. And we are part of the Pacific Rim Consortium that we have an MOU. It was actually the last consortium out of the whole APHL that was developed and implemented in 2021. And we are very proud that Guam is part of that APHL Pacific Rim Consortium. They have our back. We have Alaska there, Washington State Lab, LA County, California, Oregon, Hawaii, of course, and the USAPI the Guam is the representative for the USAPI Islands. So we, and myself and Alan, represent Guam Department of Public Health Social Services every year at the APHL. And we are proud to say that we're very active and we have monthly calls, and Dr. Vassaretti can also attest to that we do have monthly calls with the Pacific Rim Consortium. And so when we were building the BSL-3 lab, we have all the expertise that we can think of. These are the highest, they're laboratory directors for many years, very experienced, along with Dr. Eric Blank and all of the Pacific Rim Consortium, which I can give you a copy, states all the lab directors have signed it, and a COOP plan. It was actually for our COOP and continuation of operation. If ever we do not have testing capability, they will be able to accept our testing. But of course, with the testing volume, it depends on priority. So we would like a BSL-3 on Guam, and they are supportive of that. And they can attest also, if you would like in the future, for all the lab directors of the Pacific Rim Consortium.
All right, thank you. So the BSL-3 lab is what I was referring to as a CDC lab. Would you say that's the same? Okay, what we commonly refer to in the media?
Yes.
Okay. All right, thank you. So the slides are ready to go, so please
Oh,
proceed. Yeah.
So the next slide just shows the floor plan that we've been working on. And since 2014, 2015 time, we have been meeting with the subject matter experts from the United States as well as the Pacific region with SPC, PHOA, even WHO contacts. We have shared brainstorming and just the facility that would benefit our region. And this is what is the end of the result of those meetings. We've had a proposed plan before in 2015. It was a business case and pages of document, but unfortunately, the US Congress and House of Reps would always visit us every month, walking and touring our old laboratory, and they do agree that we need a new building, especially a new BSL-3 containment facility, just to prepare the Pacific region for the worst. And so the lab support, as you can see, there's the highlight of this building is the BSL-3, which is right there in the upper left. And then on the right side is the training classroom. And for BSL-3, it must be secured. It's highly and strictly secured with biosecurity system. So all these, and then the other rooms are for the BSL-2 equipment. Currently, if you see the slides, we have many equipment that we had gained or obtained through allocation. They were donated through the Human Health Services. We had emergency procurement with ELC. So our laboratory currently is quite small for the equipment that we have. We provide the best testing, but unfortunately, we've outgrown the current rental space that we are in right now, but we are making the most of it. Our biosafety cabinets are all up to date calibrated and certified. As I said, the CLIA inspection was in September this year, and they did not find any deficiencies. Next slide, please. Any questions for that? Okay. Well, the next slide just shows our future validation plans. And these microbiology culture, again, this equipment we have in our lab right now, but it's not validated. We are waiting for the delivery of supplies and reagents. And once this is received, we will, of course, do the following tests that are listed there. The Staphylococcus pneumoniae or Streptococcus pneumoniae. And then the mycobacteria culture is the Bactec midget. And these organisms are biosafety level 3. In case it is set up before the BSL-3 containment lab is erected, we will just have to do best practices or just hold on to perform testing depending on the guidelines and depending on approval from the CDC and our WHO. Next slide, please. And the next slide just shows maintaining and strengthening our partnerships. So, of course, we have CDC IRR. IRR stands for International Reagent Resource, and this is key to our setting up a test. The CDC developed the first testing for the SARS-CoV-2. It was named N2019 nCoV. That was the first name when it came out in 2020. We are diligent, and Alan himself can explain also that we are always ordering reagents and monitoring what testing we can implement and develop and establish a standard operating procedure for us to be prepared in any testing. So the IRR is for free. There's no cost to that. As long as we give data. So data integration is very important, and that's why we are purchasing right now with all the money we're having. It's put to use very well with a laboratory information management system, because back then, if you saw the previous slide, throughout pandemic, we were doing it manually, accessioning manually, and we're very thankful for interagency, Department of Public Health help from other divisions, public welfare, environmental health, and we all came together, including the National Guard. The laboratory there was not enough space for everyone to work in. So we had in shifts. The same lab staff would be 7 to 3, 3 to 11. Those are the 2 shifts. But the National Guard, there were only 6 per shift, but the same lab people. Anyways, it's just another testimony that we do need a BSL-3, and all the space that is shown there in the floor plan, that is about 35,000 gross square feet. It is made for 14 lab staff, but with the addition of even my colleagues at the state labs of APHL Pacific Rim Consortium, their BSL-3 laboratory facility is larger, and they're still expanding. When COVID hit, there was not enough room. One room was up to the ceiling with specimens, and we experienced that as well. Especially during the 2022 GVB testing, the Public Health Lab agreed with my colleagues with Director Art. We agreed to improve or help out and assist with tourism testing, and that I can say is more than the pandemic itself. We reached over 200,000 tests that year in volume, and it shows on the previous slide. But next slide. Oh, well, I'd like that slide. DPHL regional laboratory plans. So our plan is to be, yes, the regional public health lab for BSL-2 and BSL-3 analytical testing capability, and we test for clinical human specimens. And like I said earlier, workforce development and research with the University of Guam, GCC. In the beginning of COVID, we reached out to the UOG Marine Lab, Dr. Kambosh, and we were eager to set up our sequencing, but the only challenge and hiccup was just getting the emergency procurement to get those sequencing equipment. But our minds are always for the future. It's always with a vision, and we'd like to serve as the regional hub for laboratory testing, training, and research in Micronesia. I think is that the last? Thank you.
What about,
The last slide would
Yes.
be Mr. Sabino
okay,
Flores.
all right, thank you. Thank you very much.
Thank you.
Okay. So looking at the last slide, the project right now is funded by a $32 million grant to the governor from the Office of Local Defense and Community Cooperation. That money was split into two sub-recipients. I'll wait for the slide. Okay.
The final slide on the sheet.
Okay.
Start all over. Could you please state your name and
Okay,
position for the record again?
Okay. My name is Sabino Flores. I'm a senior engineer with the Community Defense Liaison Office, formerly known as the Guam Build-Up Office. Its role has since expanded from when the Build-Up Office was established. The funding source for the lab was through a grant awarded to the governor back in September 2021 for $32 million. And it was awarded by the Office of Local Defense Community Cooperation, formerly known as the Office of Economic Adjustment, OEA. There were two sub-recipients to the grant. The one was provided to the Association of Public Health Laboratories, a nonprofit organization, and they in turn selected and awarded a design contract to the firm of HDR. $27 million went to the second subrecipient, which is the Department of Public Works. Their role would be to procure the construction contract and manage the construction of the lab. The current site now is a vacant lot in Manila within the UOG campus, or near the UOG campus, between the Guam Culture Repository, and the building that houses Ron's Diner. I think most will be familiar with that landmark. It's
Sorry, and houses what? Between the two, which building?
there's a vacant lot between the Guam Culture Repository and a two-story building on the other end with Ron's Diner in it. I believe the official name is the late Frank Clito building. So that's roughly 7 acres. It's sufficient to meet the 5-acre requirement stipulated in the grant. And the status right now is with that site, we're in the design development phase. The purpose of that phase is to ensure that the needs of public health are considered and addressed in the development of the design prior to going to the construction documents phase, which would involve detailed drawings for bidding purposes. The client, of course, is the Department of Public Health, and my office is working very closely with not only the Department of Public Health, but also the designers, OCC, the grantor, and APHL, the subrecipient.
Who is the subrecipient?
The APHL, Association of Public Health Laboratories.
Oh, yes, okay. The 25 million. The
and,
5 million for the design.
Right, their primary role is to design, and Public Works has the 27 million for the construction phase.
What are your time estimates?
The grant has stipulated milestones, I believe you have a copy of the grant. So the first milestone was to complete the design ready for bid by December 31st, 2023. The expected start date of construction is June 1st, 2024, and the completion of June 30, 2026. Because of delays for one reason or another, and the recent selection of the site, definitive site, we are in the process of preparing an amendment to the grant to extend it further for more realistic completion dates. There are a lot of moving parts. Obviously, we have to go to the environmental phase to ensure that, and that's required under the grant. So we are adhering closely to the terms of the grant to ensure that the NEPA process is completed prior to any ground disturbance on the site. The Department of Land Management is currently providing survey services to provide topographic information on that 7-acre site. So they are providing surveying support to facilitate the project.
What is in your request to extend, what is your new date?
Right now, the timelines we're looking at right now that we're tweaking, we're awaiting additional information, is to complete the design by April 2025, to start construction by November of 2025, and to complete construction by November 2027.
All right, thank you.
Okay.
All right, is there any other presentation, Director? All right. Okay, we'll just begin with our questions. It should be brief, hopefully. I just want to clarify, so this lab, Mr. Flores, that you're working on is the same as what we referred to in the media as the CDC Lab?
That's correct.
The lab that Matrix included as part of its design for the medical complex?
They did reflect it in the conceptual plan, that's correct.
All right. And in their conceptual plan, they said it needed 10,000 square feet, but your drawing shows 35,000 square feet. Has that been reconciled?
Yeah, I believe it might have been an oversight on their part to revise it with the current studies and the current needs of public health.
All right, yeah, because they said 10,000 square feet, and I noticed that right away in yours, 35,000 square feet. And so if this lab is constructed, there will be no other public health lab. Is that correct? You won't have 2 labs. This is the one, you're going to incorporate your current lab and this new lab all together in one lab.
At our respective health centers, Madam Speaker, we would have what's considered satellite lab office, just so that will be where the specimens are collected. At this new facility, there will be no clients going to the new facility to have their specimens drawn. so that's the only thing that would kind of differentiate is northern and southern community health centers, and when we have the central facility back up, that will be satellite lab
Great.
sites. Yes, ma'am.
Thank you. And when this is built, so you're now proposing that it's going to be built adjacent to the Guam Cultural Repository in Manilao. There's 7 acres there, and it meets the 5-acre requirement, and it's going to fit the 35,000 square feet. Who owns this property?
Property is owned by Gulf Guam.
Government of Guam, not the university.
Not
of
the
Guam.
university, it's Gulf Guam.
Okay. All right, just Gov Guam. All right. I think this is the first I've heard of this lot being considered. So is this pretty final? You're going forward?
It's pretty fine. We're moving forward. As I mentioned, Department of Land Management is proceeding with topographic surveys
All right.
for this property.
Okay, thank you. Okay, I'm going to ask for questions from my other senators. Senator Lujan.
Thank you very much, Madam Chair. Mr. Flores, you were saying that it's final that this lot, this Gulf Guam lot will be the lot for the lab?
That's correct.
Okay. So, again, so it wouldn't have to be, again, integrated with supposedly a hospital then? If the lab is, because it has been, the plan for the hospital is to have a medical facility to be inclusive of a lab. So as this lot being identified as the site for the lab, then the governor then can remove this laboratory from an inclusion of the medical or the lab portion of the medical facility then, right?
That's correct.
That's correct.
That's
Okay.
correct.
Okay. Yes, ma'am.
May I clarify, sir?
Okay.
So this new Guam Public Health Laboratory complements and supports the hospital lab. We are not replacing it. The hospital lab is a point of care, acute care. So if they need any confirmatory testing, then that's when they would send it to this new lab. So it would be 2 separate.
Sure.
Yes, sir.
Yeah, no, but what I'm saying is, the governor's plan for a medical facility or complex, I guess, is inclusive, supposedly inclusive of this lab. So if this property is identified to build this lab, it can be, again, carved out from the medical facility that the governor has planned, right? And, okay, thank you very much, Madam Chair.
Thank you. Senator Lujan. Senator Kanata. He's good. Senator Barnett.
Ma'am, I have no questions at this time.
Senator Fisher.
Thank you very much. I'm looking at the application narrative for the lab, and my questions just go to whether or not we are meeting certain timelines under the grant. I note that by December of 21, we were to have executed a copy of the pre-construction, et cetera. Have we done that?
No, as I mentioned, we're in the process of preparing an amendment to extend those dates.
Okay, would the amendment extend and change all of the deliverables?
All three milestones that are stated in the current grant.
Okay, so all of the timelines that we received will get rolled back.
Right, correct, will be extended, correct.
And that it depends on the federal government approving that?
To approve it, that's correct. The same office, the Office of Local Defense Community Cooperation. We've been discussing it with them.
Okay.
And
Do you have an idea when you'll get the approval?
no, we intend on submitting the amendment no later than the end of the first week of November. Yeah.
I hate to be calamitous, but what happens if they turn down the amendment?
We feel confident. We just to provide the necessary justification and support the dates that are being requested.
Okay. Well, all right. Well, I congratulate all of you. I mean, that's a $30 million brand new lab we're getting. So thank you. The other question I had is, the laydown space for this lab. I understand it's in the Guam inventory, but so are you confident that this is where the lab's going to be laid down, in this property in Manilao?
Yeah, that's correct. We're confident that this will be the site. Yes.
Okay, is there, do you see any impediments to that?
No, we did verify that all the necessary off-site infrastructure to support the lab are available. Yeah.
Okay,
Power, water, and sewer. Yeah.
okay, all right, thank you very much. No further questions, ma'am?
Senator Dueñas.
C. Monsi, Madam Chair, and Mr. Flores, I guess, just to cut to the chase, I think the reason for the panel questions, and so I'm just going to finalize with this, is that there has been a speculation that this lab and this grant award was somehow being tied up by the potentiality of a medical complex as proposed in law and as proposed by the governor that's currently being discussed, and there are competing bills to that effect. So once again, just to put it solidly on the record, that is not the issue with this particular laboratory. This laboratory has a piece of property. It is established, it is in flow, and the only thing we're currently debating is the ability to receive what is normally known as a no-cost extension.
Correct.
That's excellent news. And, you know, as you know, as it was mentioned in terms of the site, EIS and going back to 2015, I know that this has been something that's been in the plans for pretty much close to a decade now. And so I think that's maybe why some individuals who may have put some sweat equity in this prior to the current individuals carrying it forward maybe had some concerns. So, Madam Speaker, for myself, the only thing is, you know, and who knows, maybe it could get better with the extension. I don't know if that's a possibility, but I think the other concern of those who have been anticipating, along with yourselves, of the eventuality of this lab is that we may be losing square footage and possible, we might have to add some revenue to construction costs in order to be able to realize what the plan is, simply because that's just a natural situation that we're dealing with, escalation costs of construction. So given the fact that this is not a delay because there's been a change in policy or the like, it's just a natural situation. So we're not losing anything here because of the fact that we've changed the plans. It's just this is the natural process that is kind of gotten hung up, if I will. Great. Would that be fair?
Yes.
Okay, Madam Chair, that satisfies my
Thank you very much.
curiosity and the curiosity of those who have, put questions to us as senators in terms of the status. So thank you very much for your presentation. Thank you, Madam Chair.
Thank you, Senator Dueñas. And Director Borja, would you like to present testimony on this matter? We did receive from you, and I pass out to my colleagues, your analysis of the potential lab sites, the spreadsheet. Thank you.
Thank you, Madam Chair. Not necessarily testimony, but I am open for questions concerning the properties that were originally looked at for the potential site of the lab.
For me, I think your spreadsheet explains it pretty well. Is there any questions for Director Borja?
One question, Madam Chair.
Any question? Thank you. Thank you, Director.
I have one question, Madam Chair.
Yes.
So, Joe, Mr. Bora, the discussion by Mr. Flores was that you're currently doing a survey work on the current identified lot, and it's for topo purposes. Do you have any or do you have any kind of a statement today as to if you see any impediments to the proposed size of the lab and with the current topography that you can at least identify from the first visual?
No, not really. The basic lot was already surveyed by a private surveyor, and it was cleared by the basic lot had a problem in the beginning with the historic preservation officer. They did find two concrete slabs in there that they, I guess, said that those were historic parts, but that's been cleared up.
Okay.
Yeah.
So
with the repository being built by federal funds, Section 106 cleared the basic lot for that.
So the general topography of this property is relatively flat and conducive to the square footage requirements that will be being asked for in this lab?
It's pretty much level.
Thank you, Madam Chair. That's
Thank
all I
you.
have.
Thank you, Senator Duenas. Thank you again to Director Borja. Thank you very much to the Department of Public Health and,
Madam Chair?
oh, sorry.
I'm sorry, may I
Senator
ask?
Fisher, did you have questions?
Yes, please. Thank you, Director Borja. I'm make it quick. I'm going to refer to, in your spreadsheet, the Route 15 Manila crown lots, 101.5 acres per the spreadsheet. I'm interested in the surrounding property value impact. Could you address that? If we were to put it up there on that 101 acres, could neighboring properties benefit from that?
Well, because presently the area does not have infrastructure. If you bring infrastructure in, that would bleed over to about 250 acres. I'm not sure how many lots that is. It's a little bit of a problem in there. The 250 acres, they're undeveloped, and it's trending towards changing the zoning from agricultural to M1 and M2.
And M1, M2 is light industrial? In other words, you could build a commercial establishment?
Warehouses. Actually, there is a warehouse there now, and there is a planned tire recycling facility further up, but there is no sewer in the area.
Okay. So if the hospital or the campus were placed on that property, it's obviously going to require infrastructure, water, sewage, electricity, roads, everything, correct?
Correct. I'm not much of a value person, but it's common sense that...
Do you believe that neighboring landowners would be able to essentially cherry pick off the utility development and, hook into the grid and without running their own lines?
For the utility agencies, I would assume that, and through my experience in the application review committee, when people apply, their application goes through the ARC, the application review committee, which is made up of a couple of the utility agencies in there, and their basic comment is, if you want it, we'll build the utilities in there, but you have to pay for it.
Sure.
Developers' fees.
Sure, but of course, if the government's already laid the lines and everything and you're adjacent to it, you can just drop right in, correct?
Correct.
Okay, so it would not be surprising at all to see increased economic activity around a new medical campus. Is that also correct?
That's correct.
And new and robust economic activity equals more business privilege tax for us to spend, correct?
Correct.
Okay. All right, thank you, ma'am.
Thank you, Senator Fisher. Senator Burnett.
Thank you. Thank you, Madam Chair. I just had a couple questions for Mr. Bora. When did you do these assessments
I
of the
believe
sites?
it was about December of 2022.
Were you aware that Public Health had selected the property within the University of Guam across the repository for the lab?
No.
Okay. That's all. Thank you.
Thank you, Senator. Any other questions? If not, again, thank you, Director Borja from Department of Land Management. Thank you again to our acting director from the Department of Public Health and Social Services. Please give my thanks to the director as well, and to all of your team from the director of the lab. Thank you again for all your work during COVID and throughout your time at Public Health. All of you, I know, have really played instrumental roles in protecting the people of Guam. Thank you also, Mr. Flores, for your testimony today and your assistance in this. And I think this is excellent news, so thank you again. Sidus Masi. That concludes our hearing on the CDC Lab, and Public Health refers to it as a
GPHL, ma'am. Guam Public Health.
GPHL is 3, especially 2 and 3 lab. GPHL Lab. All right. Sidus Masi. This hearing is concluded, adjourned. It's 3:10 p.m.